Okay. Whoa. I'm Frederik, it says right there, and this is Thomas, and we are going to be the moderators of this second session. Thomas is also going to speak in the end. I'm going to present the first speaker, which is Michael. He's my boss, so I'm going to just say a few nice words about him. I don't know, actually, if he needs any introduction, at least not for the Danish audience, because he's been all over the news since the beginning of this pandemic. But he's the PI of the HOPE project and is going to speak about those data and our findings. So, Michael?
Yeah, thank you very much. Yeah, so what I'll be talking about today is not so much about the HOPE project in general. There will be other talks that are focusing on other parts of the HOPE project. So I won't share so many wartime stories, so to speak, about what happened over the pandemic, but you're welcome to get them in the coffee breaks. What I'll focus on is behavior, how people changed their behavior over the pandemic, and what were the drivers of that. So in February, March 2020, the first wave of the corona pandemic hit the Western world. I think what happened then was probably the biggest behavioral change that has ever happened in the world. It's, I think, the first time so many people across so many countries have done exactly the same thing, which is to start doing nothing. So it hit, and what we did in the HOPE project, which was formed very, very quickly in these early days, was to begin to collect survey data. We collected rolling surveys in 8 different Western countries, trying to figure out how are people perceiving this situation, how are they changing their behavior, and what are the sort of psychological factors that influence that. And because of very, very rapid decisions from a number of different people, we were able to get into the field on March 13, which is the sort of very first day that Denmark was officially in lockdown. So what we were interested in, and what we have, one study that we have published looked into, well, who were the people who changed their behavior most when this first wave hit? We are looking at 2 different types of behavioral change, what is called avoidant and what is called preventive behavior change, where avoidant is essentially to engage in social distancing. Preventive behavior is essentially to focus on hygiene, increased attention to hygiene. And of course, the people who worried about the coronavirus, they changed their behavior more. So they both engaged in a little more physical distancing, and they engaged in more focus on hygiene. But there are also other factors than fear that could be important. In political science, I'm a professor of political science, we have a lot of focus on trust. But surprisingly, we saw that trust variables were, in fact, not very important. People, at this point of the pandemic at least, changed their behavior independently of whether they trusted the institutions and the government. And it turned out that interpersonal trust, which is often this sort of telltale cue of being a good citizen and doing what you are supposed to do, that actually decreased behavior change, because if you're a trusting person, then you're less likely to treat others as a danger, as a source of danger, which is exactly what you need to do to engage in behavior change. But these trust variables weren't very important. There was massive salience of the pandemic, and these factors didn't really matter. What mattered was, to a very large degree, what is called self-efficacy. Essentially the feeling as a citizen that you know what to do and that you feel capable of doing that. So in this sort of massive crisis situation, citizens around these countries were essentially saying, well, tell us what to do and we'll do it, and we'll do it independently of whether we trust you, the government or the authorities. Of course, things developed from there. What you can see here is the change in the number of daily close contacts in Denmark from here May 2020 until August 2021. And essentially this is the daily number of contacts within 1 meter or within 2 meters that Danes report. And one of these data are based on a massive survey that we started in May 2020, where we each day have been surveying people for the protection-relevant behaviors and perceptions. So each day we are surveying 500 people, and we have done that since the beginning, and we are continuing doing that until the end of this year, and then we hope that we don't need to do it anymore. We also hope that we wouldn't need to do it anymore at this point, but things changed. So we are creating aggregate data reports on the basis of these surveys each week that we are sending to the public, that we're sending to the Danish authorities and the Danish government. And in the welcome address where Stinus Lindgren was referring to some of the reports, this is partly what he's talking about. These are also some of the data that you will have the opportunity to work on in the weekend's Datathon, and you can talk to me, you can talk to Frederik about what is exactly in the survey, because there's a lot, and there's a lot more than just the number of contacts. But what drives these contacts? This is some of the things that we have been looking into. And we have also these surveys, not so detailed in other countries, but in these, we do have some measures on a rolling basis in other countries as well, which has allowed us to begin to dig into, well, what really creates behavior change over the course of a pandemic? And what we are seeing is that, of course, restrictions matter. When a country goes into lockdown, the number of contacts that a person has decreases. But restrictions and lockdowns is not everything that matters. A lot of the behavior changes that happen during a pandemic is voluntary as a response to people's perception of the pandemic severity, the severity of the pandemic at a certain point. So as the deaths go up, people change the behavior more, even at a given set of restrictions. It seems that deaths matter more than cases, so increasing infection counts is not enough in itself. It really needs to have some kind of severity. There's also another component that's interesting, and that seems to be that time in itself matters. We changed our behavior more in the beginning of the pandemic than we do now at a given set of restrictions, at a given set of, or a given severity of the pandemic. So there is some kind of fatigue going on. We are not as responsive now as we were early on. So what we're looking at here is behavior change at the aggregate country level. But because we have so much data for Denmark, we can also begin to ask, well, what drives local behavior? So what we have extracted from these survey data is municipality level estimates of people's attention to engage in physical distancing. And what we have been focused on here is like what happened from the reopening after the first wave of the pandemic until we entered national lockdown again with the second wave. So essentially we've been trying to look at what happened in that part of the pandemic where Denmark was trying to avoid the second wave through a lot of local lockdowns as outbreaks happened. So what you see here are the weekly estimates. Each line is a Danish municipality. Some of the lines, parts of them are like in bold. That's when the particular municipality entered into a lockdown. As you can see, there's not a lot of over time variation actually in this attention to physical distancing. It's high, so we measure it on a scale from 0 to 1, and it's high throughout, but there is an increasing trend, and there are some ups and downs as well. What drives this is, first of all, the local lockdowns have an effect. Like when a municipality go into lockdown, people focus more on distancing advice. What is very interesting is that according to these models, the local infection count actually doesn't matter at all. What really drives this sort of voluntary part of people's behavior change are the national infection cases, so all the cases. People are following what happens at the national level, and when they see things are going badly, then they change their behavior. So, to sum up, there are some important insights that I think from the behavioral side that we should take into account when you are sitting and working with the data over the next few days. First of all, a lot of the behavior changes that we see are voluntary and are based on this combination of a sense of threat and a feeling of empowerment, this sense of we can do this. And factors that will either change the sense of threat or change the feeling of empowerment, such as the trust in the advice that you're getting, will decrease these voluntary changes. Restrictions do matter. It's not all voluntary, and adds this sort of additional layer of behavior change. When we are trying to understand what is the key important type of threat that drives this, then it's really about the national threat and not the local infection threat, at least here in Denmark. So what drives our motivation to change is concern for others rather than it's a concern for ourselves. And the final thing is this notion of pandemic fatigue that the World Health Organization has also been talking about. It is real in the sense that time matters. We are less focusing on sticking to the guidelines as things go further, and part of the reason for that is the sort of mental health suffering that happens as we live through a pandemic and as we are in lockdown. We have a number of analyses of that I won't go into. But with that, I just want to say thank you so much for listening. There are far too many people that I should thank than I'm able to list here, not just the researchers of the HOPE project, but of course, especially them, but there's also a very large number of people who have been moving very, very fast, helping with all the funding, all the legal requirements, and so on. So nothing of this could have happened without the flexibility of an enormous amount of people. So, thank you.
Thank you very much for this hopeful and interesting talk. Hopefully there are questions. Please, 2 questions there on this side.
I would like to ask you, to what extent so you say that the national numbers matter more than the local numbers for changes in behavior. To what extent do you think it's because people don't know the number of local infections? Because on any given day, I would usually know the number of national infections. It's all over the place on TV, whatever. But you'd have to dig a little more to get the local infections. How many people actually do that?
No, I think that's a very important part of it, that the communication efforts go into communicating the national infection numbers, also from the public service media stations. But I think that there are also psychological reasons for it. If we look at what are the drivers, then it seems that people are much less concerned about the infection risks for themselves than they are for infection risks for vulnerable groups. So a lot of these behavior changes are altruistic or are motivated altruistically or by empathy, rather than this is something that I do to protect myself. And this is also why some countries are struggling with the vaccination campaigns, because many people are not feeling super at risk personally from COVID.
Hi, thank you for the nice talk, Michael. I'm Bjarke Frost Nielsen from the Niels Bohr Institute and Pandemics Group at Roskilde. Could you maybe go back to the slide with the municipality level attention to lockdowns? This one exactly. So there's some sort of apparent periodicity to it, or some superimposed periodic pattern. What's that?
So what we have done is to use so-called MRP models. So this is not raw data. These are estimates from partial pooling, where we are like building small models of each municipality, and then using information about like how do men and women behave in other municipalities, and plugging that in. So that's one of the sort of mythological concern that one might have. Well, how much of the lack of effect of local cases are driven by this partial pooling? But we have done what we can to sort of pull the municipalities apart.
So the periodicity of the pattern, or what do you think that's due to? The fact that there's sort of a semi-regular increase here.
Like that it goes up and then goes down?
Yes, exactly, yes.
So I think those are exactly mirrored by changes in national infections. So if you look at national infections, then they have exactly the same spikes.
Okay, good.
So that's part of what goes into that coefficient over there.
This is a somewhat longish timescale, right? That's a month or something. Several months, maybe.
Yeah, so it's from June until December.
Yes, exactly. So so the wavelength is like a couple of months, right?
Yeah.
Okay, thank you.